Hi, my name is Claudia Flores Alejandre. I'm going to be presenting the disease of the day scenario number 17. Scenario number 17 is a 35-year-old man comes to the free clinic where you are working with the red rash on the palm of his feet and of his palm of his hands and bottom of his feet. He says that he has had a fever for a couple of days and is exhibiting swollen lymph glands, achy muscles, and fatigue. When you ask about medical history, he had not had any recent illness. What is the disease? Possible diseases that I was able to do research on was syphilis. It does have the general characteristics of the rash down the bottom of the palm of the feet and the hands. Um, it could also be there's HIV or Kawasaki virus, which is known as hands, foot, mouth disease, the Rocky Mountain stop fever, the measles, and erythema multiforme. The disease is syphilis. Um, and what is syphilis? Syphilis is an infection caused by bacterium Treponema pallidum. Not sure if that's how you pronounce it. Most new cases of syphilis are sexually acquired. In the United States in 2020, for 41,065 cases of primary and secondary syphilis, the most infectious stage were reported. Approximately 80% of primary secondary syphilis cases occurred in men. Um, the rise in the rate of reported primary and secondary syphilis cases have been primarily attributable to increased cases in men who have sex with men. Men having sex with men accounts for 53% of all male primary and secondary syphilitic cases in 2020. Um, Stages of syphilis. Patients with syphilis can present with a wide range of symptoms depending upon the stage of the disease. The early stage of syphilis is compromised primary and secondary syphilis, which is typically occur within weeks to months after initial infection, as well as early latent syphilis, asymptomatic infection that was acquired within the previous 12 months. The late syphilis stage, when patients are untreated during the early stages of syphilis, they can progress to it's a late latent disease, which is asymptomatic or develop major complications of the infection. Um, it can also go to tertiary syphilis. The clinical event occurs as a consequence of late syphilis may appear at any time from 1 to 30 years after primary infection and can involve in wide variety of different diseases. Patient can present with central nervous system manifestation as neurosyphilis at any time during the course of the infection. The late syphilis stage is the tertiary syphilis. Patients with late syphilis who have symptoms may manifest involving the cardiovascular system and gumatoous disease, I don't know how you pronounce that, granulomatosis disease of the skin, and subcutaneous tissue, bones, or viscera. The late lentosyphilis, the period when the patient is infected with the T. pallidum, as demonstrated by serology testing, but has no symptoms. The late lentosyphilis, by definition, is presented more than 1 year after initial infection. If the timing of the infection is not known, late lentosyphilis is presumed. Neurosyphilis can occur at any time during the course of infection. Early neurosyphilis is a symptomatic or meningitis, systematic meningitis, or less commonly strokes, vision and hearing loss. The late neurosyphilis, the most common form, involved the brain and spinal cord involvement, dementia, and tapes dorsales. How is syphilis transmitted? It is transmitted through blood and body fluids, sexually contact with infected people or person, direct contact with the sore by kissing, infected mother to an unborn child during pregnancy or childbirth, direct contact with an infected person sore during sexual activity, cuts, abrasion, or wound exposure to infective sore. In fact, if you have unprotected sex with someone that is infected with syphilis, you have 30% chance of contracting the disease. The microbe that causes syphilis is Treponema pallidum. Um, the causative organism of syphilis was first identified in 1905. It is a bacterium from the order Spirochaetes and is one of several closely related Treponema that causes human disease. The T pallidum is very small, and so it cannot be visualized by direct microscope. The organism can be seen with dark field microscopy, a technique that employs a special condense that casts a special kind of light. How is it diagnosed? It could be diagnosed by blood test, the test that confirms the presence of the protein called antibodies. The antibodies of the bacteria that causes syphilis stay in your body for years. 4 years. The viral culture sample obtained from fluids sore under the microscope to confirm the disease, or a lumbar puncture to obtain samples of the cerebral spinal fluid between two bones in your spinal duct. The treatment. The CDC recommends 3 doses of long-acting benzathine penicillin G at a weekly intervals for the late lenticillus of unknown durations. Treatment will cure the infection and prevent further damage, but will not reverse the damage already occurred or caused. The primary and secondary syphilis, they do treat them with penicillin G, benzathine 2.4 million units IM once. The tertiary syphilis, they'll treat them with the same, but it will be, instead of being once, it will be once weekly for 3 weeks. For neurosyphilis, aqueous penicillin G 3 to 4 million units IV every 4 hours, or 18 to 24 million units continuous IV infusion for 10 to 14 days. Noted that if they do have an allergy to penicillin, there are alternative antibiotics like doxycycline and ceftriaxone. But this penicillin, if you guys have ever seen it, it is like a yogurt consistency. It's really thick. It is really hard to give. You do need to put a lot of force to try to give the injection to the point that your finger, once you're pushing the medication, it does turn like purple. The prevention, how would you prevent syphilis? Avoid sexual contact with infected person, avoid multiple sexual partners, avoid sharing needles, and use protection with every sexual encounter. And here are some of the references that I used. And thank you very much.